Now we are going to discuss some image-based different types of hypersensitivity reactions, and we will identify the image, we will identify the organ, and we will identify the pathology, and then we will see that which type of hypersensitivity reaction is this. So the first image, if we try to look, and if someone has given already some clinical manifestations, like if there is a patient, he has cough, and that increases especially at night. There will be chest pain or chest tightness or difficulty in breathing, and especially whenever he exposed to certain allergen, and his symptoms exacerbate or increases. Then you were given the autopsy or the microscopical sample, and to identify that what are the findings that you can find in the specimen of the airway. So we can see that here is a layer of the smooth muscle, and this layer of smooth muscle is quite thick and hypertrophy than compared to the normal one. So this one is the hypertrophy or thickening of the smooth muscle. Thickening of the smooth muscle. This is what the lumen of the airway. But here we can see that these are the mucus plugs and a lot of mucus plug in all the in the lumen. Then along with the mucus plug we can see certain inflammatory cells. So these are the inflammatory cells. So we have some airway disease because inflammatory cells are there. So it could be some inflammatory disease of the airway, as well as along with there will be the smooth muscle thickening. And if you see this area, we can see that there is a marked hypertrophy of the glands. So these are the glands or the mucus secreting glands. There is hypertrophy of the gland, excessive production of the mucus, and there is a glandular smooth muscle hypertrophy along with inflammatory cells. All these cause narrowing of the lumen. Some inflammatory cells we can also find in the epithelium or just under the epithelium. So we find smooth muscle hypertrophy or smooth muscle thickening, glandular hypertrophy, luminal mucus plug, excessive secretion along with some inflammatory cells in the lumen as well as in the valve. So all these points give me a hint that the patient is suffering from asthma. So these are the histological findings that we can find in an asthmatic patient. So let's go for the description. So thick smooth muscle, gland hypertrophy and hypersecretion, mucus plug, inflammatory cells. So all these findings can be found in asthma. And the staining uses hematoxylin and eosin, and this is a type of a rapid response, or we can say rapid hypersensitivity reaction. So that is the type 1 hypersensitivity reaction, and the organ is the airway. What else they're asking? Find and determine smooth muscle thickening. Here is the smooth muscle thickening. Mucus plug inside the airway. So these are all the mucus plug. Name the type 1 hypersensitivity reaction. So it's a we can say rapid type hypersensitivity reaction. Other findings that we can also find in case of asthma, these are the crystal shaped charcoal leaden crystals. So these crystal shaped substances, highly eosinophilic. These are called as the charcoal leaden crystals. So charcoal leaden crystal is also a feature that can see in case of asthma. So these are the Charcot leaden crystals. What are they? Hexagonal bipyramidal structures localized in the cytoplasm of the eosinophils. In the first and in the second lecture, I think in the second lecture, I said that eosinophils, they are the part or the component of type 1 hypersensitivity reaction. And in asthma, which is the type 1 hypersensitivity reaction, we can also find eosinophils. And inside the eosinophil in the cytoplasm, we can find some hexagonal bipyramidal highly eosinophilic crystals. These crystals are called Charcot leaden crystals. So the disease is asthma, staining is hematoxylin and eosin, reaction is type 1 hypersensitivity reaction, and the organ is the airway. Now another one. So this is what another finding that we can also find in asthma patients. So what is this? This is called as the Kirschmann spirals. The Kirschmann spirals are these spiral shaped mucus block. So these are the Kirschmann spirals. So they are the microscopic findings in the sputum of an asthmatics. They are the spiral shaped mucus block from the subepithelial mucus gland ducts of the bronchi. So sometimes because of inflammation, because of uh, coughing, there will be shedding of the subepithelial mucus glands along with the mucus plug, and they shed into the lumen and they mix with the sputum, and in the sputum we can find such spirals. This is again a feature of asthma, which is the type 1 hypersensitivity reaction. The type 2 hypersensitivity reaction, this is what a Hashimoto thyroiditis, where we can find the geminal centers. So what is the pathogenesis? Normally there is an enzyme called as thyroid peroxidase, which helps in the formation of thyroid hormone T3 and T4. So sometime autoantibodies, they are formed and they take on the thyroid peroxidase. So these antibodies called as anti-thyroid peroxidase antibodies. They are too much in number and they occupy a thyroid gland diffusely. So there will be diffuse enlargement of the thyroid gland along with multiple accumulation of these immunoglobulins, T lymphocytes. The lymphocytes, they start to aggregate inside the gland and they start to destroy the gland. So there will be reduction in the T3 and T4, along with there will be obliteration and compression of the thyroid follicles. So if we see this one, a thyroid follicle, this one is a thyroid follicle, and these are also the thyroid follicles, multiple thyroid follicles. Normally the thyroid follicle size a little bit bigger than these. So because of the infiltration of these cells, the lymphocytes, there will be compression and damage of the thyroid follicles. So what are these? These are the geminal centers, mean aggregation of lymphocytes. So this is also a geminal center. So whenever you see geminal center in these small follicles, you must need to think about the Hashimoto thyroiditis. So which type of hypersensitivity reaction where antibodies are formed? This is a type 2 hypersensitivity reaction. So the staining is H&E. It's a type 2 hypersensitivity reaction and the organ is thyroid gland. Now what they are asking? Geminal center location. So these are the geminal centers. Thyroid follicle location. These are the thyroid follicles. All these are thyroid follicles. Name the type 2 hypersensitivity reaction. So it's antibody dependent, cell cytotoxic, reaction. The next finding that we can also find in Hashimoto thyroiditis is the Harthal cells. So this is again the Hashimoto thyroiditis, and the finding is the Harthal cells. So what are the Harthal cells? Harthal cells are these bigger cells, larger than that of the normal follicular cell, along with a bigger nuclei with prominent nucleolus. So if I consider this one is a thyroid follicle, normally the cells are not that much big and eosinophilic. So bigger atypical nuclei and prominent nucleolus and pinkish cytoplasm. These are the Harthal cell. It can also find in some cancers of thyroid gland. So Harthal cell again see in case of Hashimoto thyroiditis, H&E staining, type is hypersensitivity, type 2, organ is thyroid. The next one is a Graves' disease. So Graves' disease is a very common in female, especially female, and a lot of questions they were asked and about the Graves' disease. So we have two image number 1 and image number 2. Here we can see this is the normal follicle. Previously we saw the Harthal cells, which are quite big than these follicular cells. So all these are the follicular cells, and inside the follicular cells, in this space where all these follicular cells are surround, this is the surrounding follicular cells, these are the nuclei. If I draw one follicular cell like this, another one like this, oh, all these are the follicular cells, and these follicular cells are making T3 and T4 and sending to the inside the colloid. So this eosinophilic homogeneous collection inside is colloid. So all these are colloid, and this group of cell is medullary cell, which is responsible for secretion of calcitonin. So these are the medullary cells. So we have follicular cell and medullary cells. So if you compare this with the two image, we can see that all the follicular, they are disturbed. The colloid become small and less eosinophilic. Compare. This one is a completely circular. Here is not a complete circular. Like glandular cells, these cells trying to come inside. So why this is happening? This is happening because of the hyperplasia of the glands, excessive production. Why? Because antibodies are forming. Which type of antibody? Stimulatory antibody. So these stimulatory antibodies are called as thyroid stimulating antibodies. So what they do? They cause thyroid receptors. For example, this is the follicular cell, one follicular cell. So they have a receptor for TSH. And this TSH causes increase in the level of T3 and T4. Now instead of this, these two antibodies comes and attack and causes excessive stimulation. So causes excess release of T3 and T4. That causes gland to form a structure like this, not like this one. Along with that, another finding is the whitish vacuolar areas just near the follicles inside the colloid. So what are these? These are called as the mouth-eaten appearance, and mouth-eaten appearance is classical or specific for Graves' disease. So now what is this? This is a Graves' disease, mouth-eaten appearance, H&E staining. Which type? Type 2 hypersensitivity reaction, that is anti-receptor antibodies, but they are not inhibitory, they are stimulatory antibodies. The organ is thyroid, normal and disease one. This one is a normal, this one is the disease one. Thyroid follicle location, all these are thyroid follicles. And name the type 2, that is the, we can say, antibody dependent cell cytotoxicity. So this one is the thyroid gland, and there is a diffuse enlargement of thyroid gland. See, the thyroid gland becomes so enlarged diffusely. So this is the goiter. The next one is a clinical finding that you can find in case of a rheumatic fever. So if you see this image, we can find these are the skeletal muscle, the cardiac muscles. All these are the branched multinucleated fibers, intercalated disc, striations, multiple striations, nucleus, nucleus, these are the nuclei. And what is this? A collection of inflammatory cells. Collection of inflammatory cells or the immune cells. So this is myocarditis. If a patient has a history of pharyngitis, then there is a development of cardiac symptoms, and once you get the microscopical specimen of the myocardium, and you start to see on microscopy, and then you found something, such things like this. So this is the granuloma, a collection of inflammatory cells. So this is what called as the Aschoff nodule. And where we can say Aschoff nodule? I said that if a person has pharyngitis, cardiac symptoms, then you find something like Aschoff nodule, granuloma, then we will go for rheumatic fever or rheumatic myocarditis. So what is this? Rheumatic myocarditis, Aschoff nodule, H&E staining. This is again type 2 hypersensitivity reaction, but not stimulatory, not inhibitory. These antibodies are destructive and cytotoxic. The organ is heart. Next one, if we go more deeper in the same image, in the Aschoff nodule, then we can find such inflammatory cells. So those inflammatory cells that we can find in Aschoff nodule, there we can also find some special type of macrophage with a caterpillar or screw like nuclei. So Aschoff nodule contains some specialized macrophage with a spiral or caterpillar shaped nuclei. This is what we call as Aschoff cell. We can also find here Aschoff cell, Aschoff cell. This is the zoom Aschoff cell. And these are the other inflammatory cells along with the necrotic portion. And this is the cardiac muscle. So what is this? This is the rheumatic myocarditis, Aschoff cells, H&E staining, type 2 hypersensitivity reaction, and organ is heart. Next one is an image of the histology of a kidney, where we can see that these is the parietal layer of a Bowman's capsule, the visceral layer of a Bowman's capsule. Then there will be endothelial cell and some mesangial cell, some sort of podocytes, So this is the glomerulus. So inside the glomerulus we have some aggregations. So what is this accumulation and aggregation? And if a patient has symptoms like oliguria, decrease in urine output, there will be hematuria, blood in the urine, then there will be hypertension, preorbital edema. We can say that the patient is suffering from glomerular nephritis. And on autopsy, on sample, examination, microscopic finding, we find some aggregations, subepithelial deposits. So what are these? These deposits, they are the antigen antibody complex, and these can find in case of streptococcal, post-streptococcal glomerulonephritis, systemic lupus erythematosus. In such diseases, we can find immune complexes. So whenever there will be immune complex deposition, that will be the type 3rd hypersensitivity reaction. So now we can see here that this is the glomerulonephritis, like SLE, H&E staining deposit. They are the antigen antibody complex deposition, and antigen antibody complex deposition can see in type 3 hypersensitivity, and the organ is kidney. Moving to the last one, type 4 hypersensitivity reaction is, for example, if there is a contact with certain leaf or plant, then certain chemical like catechol molecule from the plant binds with skin protein. For the first time, first interaction is sensitization phase. And after 7 to 10 days, the T cells activate and they become T memory cells. But in sensitization phase, there will be no dermatitis. So this is the primary contact or the first contact. When the person gets contact with the plant again in the next time, repeatedly, then there will be a rapid response, 1 to 2 days. This is the effector phase, where the already T memory cells, which I remember, they become activated and they will give a response. And the inflammatory response in the skin, that is the dermatitis. So this can happen in secondary contact. So in sensitization phase, no dermatitis, very rare symptoms. In effector phase, symptoms will appear and within 1 to 2 days. Then this one. So here we can see dermatitis. So contact dermatitis is a type 4 hypersensitivity reaction. So this is what contact dermatitis, type 4 hypersensitivity reaction. Organ is the skin. Thank you very much.